be on hypothyroidism. The members are Atano, Mackenzie, and Danica. The first question we ask is, what is hypothyroidism? Hypo means low. Thyroidism is that cause from low thyroid hormones in our body. This is thyroid hormone, the thing that we see in here. So it is only not because low thyroid hormone, it's also when it is underactive in our body, hypothyroidism will be caused. So it's insufficient amount of thyroid, at the same time insufficient stimulation and inadequate circulation in our body. The two main hormones that are produced by our thyroid are T3 and T4. And T4, which is mostly inactive, 93% of our body is worked by T3. What does thyroid hormone do in our body? Thyroidism mainly controls our metabolism system. So when the thyroid hormone is lower, or the circulation is not sufficient, what will happen is slow our metabolism. It commonly manifests as slow physical and mental activity, lower activities. It can be in any part of our body. It can be generally like fatigue, feeling cold, not gaining weight. It can also cause hair loss, lung problem, skin problem, heart problem, even reproduction problem. What causes hypothyroidism? The most common cause of hypothyroidism is low iodine in our nutrition. That is all over the world, but in the United States, the disease called Hashimoto disease is caused by autoimmune disease, but there are also other reasons. Surgery can cause hypothyroidism. Medication also can cause hypothyroidism. Some other factors which affect our pituitary gland also can cause hypothyroidism. When there is a severe hypothyroidism, the problem is called hypoxemia, and which is severe, that can cause heart failure, hypoventilation, hypoglycemia, and hyponatremia. Thank you.
So my focus is going to be on medical management of hypothyroidism. So first, you want to instruct your patient that the disease is lifelong. So you're going to have to be on thyroid replacement therapy. Synthroid is a common medication that's used in the hospital setting. Antiarrhythmics are used for slow heart rate, and stool softeners and laxatives are also used to prevent constipation, because with hypothyroidism comes that. So a patient in the hospital setting, you're going to assess vital signs. You're going to keep your client warm to avoid hypothermia. You're going to assess their food intake, remind them high fiber foods are important. You're going to monitor for any worsening of their condition, because with that comes the myxedema coma. The antiarrhythmics, as I said before, for slow heart rate. Daily weights are really important. Low calorie diets are really important. And if you have a patient who is on medication already, you're going to monitor for hyperthyroidism, because in excess of that medication, your system's going to shoot your thyroid hormone up through the roof. So treatment during pregnancy is really important, because when you have a developing fetus, if you don't treat that hypothyroidism, then it's going to transfer to the fetus. Let's see. So, as I said before, hypothyroidism is treated with the hormone replacement therapy. It's given under the care of a physician, and it can take a couple of weeks to notice any effective treatment. So.
All right, and I'm going to do the wrap up. I'm Danica. We're going to talk about stress management, life adjustments, and support systems. As Mackenzie stated, this is a lifelong disease. There is no cure. Stress management is key. Deep breathing, medication management, and yoga. You want to slow down, be positive. This can be a hard thing to deal with. Meditation, yoga, relaxation, all key. Increasing your fiber, that also helps with constipation, digestion, which can make you feel better just in general and overall dealing with this. You want to encourage my patient to avoid coffee. Coffee interferes with the medication absorption. So unfortunately, out with the morning coffee. You want to encourage them to increase that water intake. That increases their metabolism. So reducing constipation and getting those toxins out. So drink, 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 water, water, water. Also encourage that family support system. Support system is key, 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 very essential. Family and patient education is key. Doing all these things that Adhanom explained earlier, that Mackenzie explained, and that I have explained, this will help the patient and the family cope with hypothyroidism. Thank you.